Utira-C is used to relieve discomfort, pain, frequent urge to urinate, and cramps/spasms of the urinary tract caused by an infection or a medical procedure. Methenamine and methylene blue help prevent the growth of bacteria in the urine, while salicylate acts as a pain reliever. It also contains an ingredient to make the urine more acidic, which helps methenamine work better. Hyoscyamine is included to relax the muscles of the urinary tract to relieve cramps/spasms. It's important to note that Utira-C should not be used to treat a urinary tract infection. For bacterial infections, consult a doctor for antibiotic treatment. This medication is not recommended for children younger than 6 years old because they may be more sensitive to the side effects. As for the optimal timing and daily dosage, consult your doctor. When taking Utira-C, it is important to follow your doctor's instructions. Typically, the recommended dosage is 4 times a day, each time with a full glass of water. It's important to wait at least 10 minutes before lying down after taking the medication. If you experience stomach upset, you can take it with food. The dosage will vary based on your medical condition, age, and how you respond to the treatment. It's important not to increase the dose or use the drug more frequently or for a longer period than prescribed. Taking it at the same times each day will help it be most effective. It's important to note that antacids can decrease the absorption and effectiveness of Utira-C, so if you take antacids, take them at least 1 hour before taking this medication. Be cautious with caffeine, as it can increase the side effects of Utira-C. Avoid consuming large amounts of caffeinated beverages or chocolate while taking this medication. If you don't see improvement in your condition after a few days or if you experience symptoms of a urinary tract infection, such as painful or frequent urination, be sure to consult your doctor. If you experience nausea, vomiting, dry mouth, dizziness, or constipation, you should tell your doctor or pharmacist. To relieve dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. This medication may cause your urine and sometimes stools to turn blue-green, but this effect is harmless and will go away when you stop taking the medication. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. However, if you experience serious side effects such as eye pain, signs of kidney problems, or signs of liver problems, you should seek medical help right away. In rare cases, this medication may cause extremely high blood pressure, which could be fatal. If you experience severe headache, chest pain, or sudden changes in vision, you should seek medical help immediately. While a serious allergic reaction to this drug is rare, if you notice any symptoms such as rash, swelling, or trouble breathing, you should seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, you should contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Utira-C, make sure to inform your doctor if you are allergic to any of its ingredients or other medications. Also, let them know about your medical history, especially if you have kidney or liver problems, urinary blockage issues, or any other health concerns. This medication may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. Avoid driving, using machinery, or doing anything that requires alertness. Limit your alcohol, tobacco, and marijuana use to lower the risk of stomach bleeding. Utira-C may make you sweat less, increasing your risk of heat stroke. Be cautious when working or exercising in hot weather and make sure to stay hydrated. If you experience symptoms of heat stroke, seek medical help immediately. Inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products, before undergoing any surgical procedures. Children and teenagers should not take this medication if they have chickenpox, flu, or any undiagnosed illness without consulting a doctor first. Older adults should also be cautious as they may be more sensitive to the side effects. Pregnant women should avoid using Utira-C after 20 weeks of pregnancy, unless recommended by a doctor, as it may harm the unborn baby and cause complications during labor. It also passes into breast milk and may have undesirable effects on a nursing infant, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Utira-C. This medication may interact with a variety of products, including certain high blood pressure drugs, Parkinson's disease drugs, and sulfonamide drugs. It may also increase the risk of bleeding when taken with other drugs that also may cause bleeding. Additionally, taking other MAO inhibitors with this medication may cause a serious, possibly fatal, drug interaction. It's important to avoid taking other MAO inhibitors during treatment with this medication. Before using this product, it's also important to report the use of other drugs that may increase the risk of extremely high blood pressure when combined with Utira-C. Be sure to check all prescription and non-prescription medicine labels carefully, and tell your doctor or pharmacist if you are taking other products that cause drowsiness. Lastly, keep in mind that this medication may interfere with certain lab tests, possibly causing false test results. Be sure to let lab personnel and all your doctors know you use this drug. If you or someone else has taken too much Utira-C and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include fever, fast or pounding heartbeat, severe dizziness, seizures, slowed or shallow breathing, and unusual excitement. If you notice any of these symptoms, seek medical attention right away. This medication is used to make the urine less acidic. It is used to treat certain bladder and urinary conditions such as urinary tract infections, kidney stones, and gout. It helps prevent these conditions by making the urine less acidic. Take this medication by mouth, usually 4 times a day to lower the risk of kidney stones and gout. If you are taking this medication to treat a urinary tract infection, take it as directed by your doctor, usually 4 times a day for 7 to 10 days. Take this medication with a full glass of water, 8 ounces/240 milliliters, unless your doctor directs you otherwise. Do not lie down for at least 10 minutes after taking this medication. If you are taking the liquid form of this medication, shake the bottle well before each dose. If you forget to take a dose of Utira-C, you can take it as soon as you remember. However, if it's almost time for your next dose, it's better to just skip the missed dose. Do not take a double dose to make up for the missed one. Remember to take your next dose at the regular time as prescribed. It's important to store Utira-C at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and out of reach of children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly dispose of the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for proper disposal instructions. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.